I just went outside my house and I slipped off my bottom stair. It had some ice on it. And when I fell, I heard something crack.
After a fall that broke her leg, Debbie Boissonneau, the president for CUPE Local 204, says she waited for 30 minutes for an ambulance to arrive. The delay left her with very little choice.
The phone rings and my husband answers it, and that's the ambulance saying that I'm very sorry, we have a delay and we're coming, but we will be still a bit of time, and started asking questions. And I was in quite a bit of pain and crying, and so my husband said, we're going to have to get her to the hospital. We can't wait any longer. We've been waiting 30 minutes. And they said, I understand. And that's basically where the conversation ended.
Since 2019, there's been an increase in ambulance wait times, with the rise of just over 5 minutes. Last year, wait times for high acuity calls was nearly 20 minutes.
I would say every minute you wait when there's a 911 call is significant.
According to the Winnipeg Fire Paramedic Service, the goal is to have a provider by the patient's side in less than 9 minutes. Manitoba Government and General Employees Union President Kyle Ross says the shortage of paramedics is what's causing the rise of ambulance wait times.
We need more paramedics hired, and we need more paramedics trained so we can bring those numbers down, because there's just not enough people to do the work.
According to Ross, since the pandemic, paramedics have been stretched thin, which is resulting in burnout.
Besides hiring, we can do community medicine, paramedicine, where now we don't have an ambulance, a transporting ambulance going to a low acute call, where they can actually go to the high acute calls, and the low acute calls can be handled by community paramedicine, which will alleviate some of the stress on the system.
The Winnipeg Fire Paramedic Service currently has 17 ambulances that operate 24/7 and an additional 11 during peak hours. They also have 3 community paramedic units on every shift. The WFPS says they're working on the negotiation of a new service agreement with Shared Health and are unable to speak to the details of those discussions.
And we saw a fire truck go, past us the other way. And they did show up at my house, and they were saying, there's been a lot of overdoses. We're very sorry. Even if the firemen had come, could help me get into a vehicle, but we had nothing. We had to figure it out on our own.
In Winnipeg, Sweet Arasi, City News.